actually in a time now where we're moving quite quickly into combinations in heavily pre-treated patients, which we weren't at before. And that's exciting in kidney cancer.
We're going to start in the refractory space.
So this is clear cell kidney cancer in individuals who have been pre-treated with immune checkpoint inhibition and VEGF targeted therapy. And the question is, what is the current standard of care? Well, currently we're just sequencing single agent VEGF TKIs.
Generally.
The history of combining drugs in kidney cancer, particularly combining VEGF targeted therapies together, hasn't been that successful. The question now is, are we going to be able to change that? So the first place to start is with Lenvatinib with Everolimus. We saw a randomized phase 2 at ESMO just recently, where actually from PFS and from a response perspective, it looked better than single agent Cabo.
It did.
And so from that perspective, we have a combination. Now it's obviously it's mTOR plus VEGF TKI, but in the past we've always really been focusing on PD-1 VEGF combinations.
Right.
So that's new and that looks active. But then about a week later, we saw a press release for Belzutifan, which is a HIF inhibitor, in combination with Lenvatinib, beating Cabozantinib in heavily pre-treated patients. Now, there are some issues around component parts, because in an ideal world, you'd have Lenvatinib alone, but actually, I don't think Lenvatinib is more active than Cabozantinib.
I don't know.
Oh.
I think that's an open question. I think when I saw the Lena versus Cabo, I think Everolimus is minimally active, and so it made me think for the first time maybe it is more active. I don't know.
Okay.
It's a hypothesis.
There are other second generation HIF inhibitors. So we've got Casdatifan plus Cabozantinib versus Cabozantinib
Peak
alone.
One trial.
The Peak 1 trial. So that's another study in that space.